Okay, good morning, everybody, and thank you for joining us. It's another Fertility Talk live. This morning we are talking to Professor Kruger, Professor Thinus Kruger. He's from the Aevitas Fertility Clinic, and Aevitas is out in Pinelands, am I correct?
Yes, we are at Fertility Hospital now.
Okay, so Professor Kruger, he's the founder of the first IVF clinic in South Africa, Tygerberg Fertility Clinic, and the co-founder and partner of Aevitas, established in 2003. So we are always very happy to have Professor Kruger because I think everyone looks up to him as one of, the founding people in South Africa when it comes to fertility treatment and stuff. And Aevitas is a very, very well-known clinic. And I think there's so many women out there that has actually been to Aevitas or at least had some type of interaction with Professor. So thank you for joining us this morning. And as part of PCOS Awareness Month, September, we are doing most of our talks this month on PCOS, and this morning's topic is PCOS and the male fertility factor, or the male factor. And so I'm going to hand over to Professor. Thanks, Professor.
Thank you very much. I appreciate the invitation. Always nice to speak to your audience. I suppose they see my slides, and I want to start immediately. Let me just see if I can move the slides. No.
Okay.
No.
You still just need to share it, Professor. We're not seeing it on our side.
Oh, so I'm escaping, and I just want to see if I can, because you must. I've logged in.
Yeah.
Let me just see, because it's you that must give me permission.
Yes, I've given you permission.
Share. So I'm giving, I share the screen. So let's see.
There we go. We can see that now.
All right, great. And do you see, are you seeing slides on the side as well as the big slide?
That's correct.
Yeah. When I press the F5, I don't get that, but I'll have to run
manually
technique. All right. So I'm talking about the male and PCOS. And why do we talk about the male and PCOS simultaneously? The reason is, and I'll show you the data, that we cannot see the female in isolation. Because, and I'm stating that, and that's actually my main message, that if you suffer from PCOS and they don't look at your husband, get an opinion for the husband, because 34% of couples with PCOS will have a male factor. And some of them, there's lifestyle issues. So it can be that half those women, let's say there's 100 women with PCOS, 50 of them will have, with their problem, also a male problem. And I think if you learn that today, it's enough. So I'm moving to the next slide, and just saying that there was a workshop in Holland, and the main message here is that in the young age group, we are dealing with the PCOS group and infertility, but it is important to know, can you see the reproductive medicine specialist, the gynecologist, the dietitian, the endocrinologist? Do you see that on your side?
Yes.
So that is multifactorial, multidisciplinary approach. And don't be afraid with your doctor to get other help. We must get help for the male. We must sometimes get a dietitian involved with the PCOS patients to make their chances of success better. So I would say that is the next very important point. And then we're going to talk a little bit about pregnancy and the complication prevention. All right. So I'm just getting to the right. So the pregnancy-related problems are that if the patient is obese, there's a very high risk for diabetes in pregnancy and hypertension. And that is the second point that I want to make. You can prevent these complications. Also, the impact on the fetus. This slide, you see that babies born from PCOS may have an increased risk for their health, and even the babies can die. So point number 2 is, if you give attention to lifestyle issues and get the multidisciplinary help, you can have a healthier woman starting to plan for pregnancy. So we must not just jump in and say, I must fall pregnant now. You must see, what can I do to make the health of the PCOS woman better? What about metformin? It will not change necessarily the outcome of the baby. So we mustn't just rely on metformin. Metformin's got a specific place. And it's correct that some patients are put onto that, but it will not prevent complications if you don't help with a lifestyle correction. So 2 things. Lifestyle correction will improve outcome. I'll show you how. And lifestyle correction can also help the male. I'll show that to you. So this is the beginning. I said male factor, and I've said to you, I just want to show you, sorry. Here is the publication that we've published on this male factor story. And we've seen, my colleague, Dr. Dani Botha, was a student with me, and we evaluated the male factor and anovulation. We saw that 12.8% of these couples, a severe male factor. A third of them, the men is subfertile. They need attention, they need help. And even if the semen quality is good, but the husband is smoking, he's not as fertile as the semen test. So don't just go on a test, go on the whole profile of the couple. So I call that the holistic approach. This is Dr. Botha, and this is our publication on endometriosis, but we did the same thing for anovulation, and that's where we got those figures. So immediately now you have a message: I cannot be seen in isolation as female. My husband must be seen with me. It takes 3 months or more to improve the semen. So we can't start with the male after 6 months. We start with him immediately. Right, and then a few slides on lifestyle. These factors on the left: diet, BMI, smoking, drugs, caffeine, stress, and of course, age is not a lifestyle factor, but we must always bring age into play. All these factors can affect pregnancy chances. So these factors are on, if the audience, if there's someone with no ovulation, anovulation, PCOS, these factors are under your control. And you can yourself positively or negatively influence the pregnancy outcome. And I've told you, you can prevent complications if you do the right thing. So first of all, obesity. Diet is beneficial for both male and female. It will improve both of those, the fertility. And there's many references on that. So how common is obesity? In America, 35% of people over 20, they suffer from obesity. And I think in South Africa, it will be the same. Obese men have 3 times more semen quality problems, but not only that, they also have erectile dysfunction, sexual problems, often in just the weight. And if you can control the weight and you bring in the dietitian, that is the multidisciplinary approach. And if we need an endocrinologist, if we need a urologist, we can assist the couple. Women, the same, 35% overweight, and lifestyle will help you. So they say that metabolic syndrome, that is the condition where there's a risk for diabetes and so on, you need to, if the BMI is above 27, you can undergo glucose tolerance test and metabolic screen. And this is where I use the physician, the internist, or the endocrinologist to assist me. My focus is fertility, but I see the red flag. I've put that in red so that you know if you need that test, if you are overweight. There's a higher chance also of miscarriage. So if we don't correct the weight, and it must be a realistic aim. So I'll talk about that, what is realistic, but we can prevent miscarriages. And in the end, if you lose 5 to 10% weight, there's also a much better chance that you will be successful to become pregnant. Not only will you reduce your complications in pregnancy, but your chance, your time to pregnancy will be better. So weight loss will improve ovulation, weight loss will improve semen quality. Now, what can we do for the men? And the women can write down what I'm saying here. There's 34 studies that showed if you give oral antioxidants to the male, you can improve his fertility. Now, what are they? You can buy vitamin C over the counter and you can feed your poor husband with that. You can buy oranges from the greengrocer and you can give him an orange a day. You can buy vitamin E, 300 units per day, and give that to him. Vitamin C, vitamin E, you can buy zinc over the counter. The dose is 40 milligrams a day. It will help the sperm. And the folic acid that the female should be on to prevent spina bifida is also very good for sperm. So vitamin C, zinc, folic acid, and there you go. Husband will become healthier and the semen quality will improve. So let me just, So Cochrane review, that is the basis. There are studies, other studies, but we rely many on the Cochrane review a lot to guide us. And can we do harm with vitamin C, vitamin E, zinc? No, can't do any harm. Stress. Women trying to fall pregnant and their husbands are often stressed. And that affects about a third of women that will come to you with this problem. So if you give attention to that, and now again, it's multidisciplinary. I will involve a psychologist easily. I will help the patient by giving cognitive therapy. What is that? You let her write every day and get stress release from that. But sometimes they need a psychologist to help them. If you just put them in a support group, you will see that the pregnancy rate, 55% with behavioral therapy, 54% versus no intervention, 20%. So there's Dunbar, a good number of studies showing that give attention to stress. Stress on men, the same. Stress will reduce semen parameters because it affects the brain, and the brain secretes hormones to the testes, and if that is affected, the semen quality will decrease. And as you give attention to female, see the couple as a unit, involve the male and the female together with stress. Sorry, I got a jump here in my slides. So just the principle, don't be afraid to consult wider. And I told that to doctors last week at a big conference also. You involve a team if you need a team. PCOS is complex and you can never see the female alone. I told that also to the doctors. Smoking, of course, very toxic, and 35% of men are smoking, and they can have a normal semen test, but there's DNA damage done by the smoking. If they stop, they will improve the quality within 3 months.
Okay.
Men who smoke have decreased semen parameters, count, movement, everything is affected. Women, the same. And I always tell the women, if you have PCOS and you're smoking, if you're 35 and you have a PCOS, you want to fall pregnant now, and you're smoking, you're actually 40 years of age. And 40 years of age plus is very different from 35. Good news is, if you stop smoking, you will become 35 again. Alcohol have an effect on semen parameters, and a male must never drink more than 3 drinks at a given time, never. Binge drinking, you shock your sperm and you put yourself back every weekend by drinking too much. A glass of wine for men, a beer or 2, 3 is fine. But if you go beyond that, problems. So in females, if they take alcohol, the time to pregnancy is longer, and there's more abortions, and they enhance their anovulation. PCOS patients got ovulation problems. Anovulation means I'm not ovulating. So even affecting the embryos. So ladies, sadly, I'm a wine lover, but if we are dealing with PCOS, better not to take alcohol. Marijuana, dacha, affects the semen, affects the ovulation, affects the potential to release the egg. So don't go there. I had someone yesterday, male and female, taking marijuana. They understand. I've called her this morning, and they already made the decision. They're walking away. They understand the impact. I also have men with no sperm, and sometimes it's the gym. It is anabolic steroids. So if a male's got muscles like me, you see my muscles? No, you don't. I don't know. They have a risk of using anabolic steroids, and that will nosedive. The sperm will be 0. But if they stop that it can turn around. So drugs, medication, things that you don't know what it can do, query everything and discuss it with your doctor. Coffee. I'm not giving good news this morning, but 50 milligrams of caffeine in a 16-ounce Pepsi, I suppose that's a big one. And Starbucks big coffee, 330. Now the time to pregnancy is increased. It takes longer to fall pregnant if you take too much coffee. So I tell my patients 1 or 2 cups a day, that's fine. But if you go, the female, beyond that, it's not fine. The good news for the men is that the sperm not affected by caffeine, it enhances the movement. But for the female, it can be devastating. And look there, 4 to 8 cups of coffee when you're pregnant can cause your baby to die. So I think it's very important that we give attention to our diet and lifestyle. So approach, I've told you, holistic, we get different disciplines involved. And second, I've listed them there again, we're not afraid in our unit to consult widely. So we want to we want to achieve weight goals before fertility treatment. This will improve ovulation induction success, and it will also improve the semen quality. So what about now that we've achieved success, there's 5 to 10% weight loss, the physician is happy with the health of the female, the dietitian is happy. How can we induce ovulation? I'm just going to touch on 2 things that we do. One is you can use clomiphene citrate or aromatase inhibitors. One of the names for that drug is Femara. They are both very good. And we start usually with Clomid on 50 milligrams, go to 100 milligrams, and hope it will work, or use the aromatase inhibitor. Your doctor will guide you there. I'm just saying they can be very successful if you've corrected. I'm bringing lifestyle in here. They interlinked. Metformin alone is less effective, but if you must do addition of metformin, sometimes you must, or there's metabolic syndrome, that metformin will help the Clomid or the Femara to work better. So if there's resistance to Femara or Clomid, we add metformin, even if there is not metabolic syndrome. All right? Almost at the end of the lecture.
Now, if you don't mind me saying something, Professor,
yes.
I'm hearing you what you're talking about, the Clomid, how it works and things like that. And I had three pregnancies which unfortunately ended in miscarriages, and I suffer very badly with PCOS. And every time I actually conceived was only when I started working out and eating healthy. That was the only time, and it was naturally without the Clomid and stuff. But when I was on the Clomid...
This is a very important point that you're making. If you correct lifestyle, I have many patients doing exactly what you did. They start cycling and they fall pregnant on their own. Thank you for that. That is very, very important point. Okay, so, but if we need something, we have drugs. If there's resistance, we add metformin and we try the drug again. And we never stop with lifestyle. That is so important. One can also give injections if the metformin and the Clomid is not working. I'm not talking about that today. And you can also do a surgical procedure called laparoscopic drilling, but only if you've tried the weight loss and you've made that, can start ovulating on your own and fall pregnant, or do the simple things. But one can put the little needle in the ovary, and this is more for the doctors. It's very low voltage. It will change the hormonal cycle, and the ovary will start working in those in need. This is not first-line therapy. This is fourth-line therapy. And here you can see it's just 3 little holes that a doctor that's knowledgeable about this, you don't do the following. You don't put that ovary. That's wrong. So but that is for the doctor. And
I've had that done also.
It's 80% successful. It is as good as the injections in the right patient. So it helps many. So I'm summarizing now by just saying that if we are correcting the lifestyle, all these factors on the left, the pregnancy chance will be improved and the complications will be less. I've made the point in the beginning, know that there's a high percentage of male factor mixed with the PCOS goals. And then I've said to you, we use many doctors to assist in this complex problem. Thank you. That's all that I wanted to say, but it is a mouthful.
Yes, thank you very much, Professor. You're actually given us such great insight on this, and especially with the male factor as well. And what I'm always trying to get from different doctors is what can men take to try and improve, their
And
semen.
you've got that.
And you've now given that, so that is absolutely great, as well as a support group. So I've taken quite a bit from it. Thank you very much, and I'm sure you're going to help so many women with this talk.
Yeah, thank you. It was a privilege, and thank you again for inviting. So I'm saying then goodbye now. Is that right?
That's right. Thank you very much, Professor, and have a good weekend.
Okay.
Thanks, everybody.
Thank you. Goodbye.
Bye. So thanks everyone for that joined us today. If anyone wants to get a hold of Aevitas Fertility Clinic or Professor Thinus Kruger, please contact them. You can go to the website aevitasfertilityclinic.co.za, or I think it's just Aevitas Fertility. They're also on Instagram and on Facebook as well. And thank you everyone for joining. I'm going to put up a nice post with the great information that we received from Professor Kruger today. So have a great weekend, and thanks for joining us again on Fertility Talk. Goodbye.